Assalamualaikum. A model for preventing and treating contemporary psychological illnesses in Malaysia from Islamic law perspective. Psychological illnesses have generally spread throughout the world, particularly in Malaysia. The cases of patients with psychological illnesses are increasing, the most common of which are anxiety and its disorders, depression, stress, fatigue, schizophrenia, and other psychological disorders. Cases of patients with psychological illnesses have reached more than 1 million Malaysians over 16 years of age and are increasingly prevalent in productive workplaces. Also, some of these diseases, such as depression, fatigue, and isolation, are widespread in Malaysian schools and universities. And a study indicated that there is an increasing prevalence of mental and psychological disorders in rural areas than the capital Kuala Lumpur. A study also revealed that a large percentage of Malaysian society suffers from depression and anxiety disorders, which is the biggest health problem affecting Malaysians after heart disease. Studying this topic is very important, and it needs specialized and in-depth study, especially since there are no previous peer-reviewed studies that have addressed it from this angle. Problem addressed, it is no secret that these diseases have serious effects on individual and society, causing an annual loss of productivity and then a weakening of the economy as the patient's psychological burden increases due to the deterioration of his health, and this burden is embodied in the control of negative thoughts that are difficult to control, so they tend to isolate themselves in order to avoid the stigma they face in life. And some of them are unable to deal with all that burden, so with all that pressure they decide to end their lives by suicide. A large percentage of patients do not receive beneficial treatment for them. The main question is, what are the preventive approach to psychological illnesses according to Sharia? In this study, the researchers will follow the qualitative approach in which the researcher is committed to collecting data related to psychological illnesses from approved and reliable sources and references, and they will be used to identify traditional methods and techniques for preventing psychological illnesses, analyzing them using a content study method, then deriving the best and most appropriate methods for preventing psychological illnesses, supported by the opinions of contemporary doctors. Findings indicate that the most important common psychological illnesses in the world in general and in Malaysia in particular, which are accompanied by similar symptoms, the following: anxiety or depression or obsessive compulsive disorder, schizophrenia, autism or autism disorder, bipolar disorder, and psychogenic epilepsy. Second, medical professionals and researchers in the field of psychiatry have not clarified the specific and precise causes and factors that led to the spread of these psychological illnesses. They are still unknown to them. And the therapeutic and preventive model for contemporary psychological illnesses in Malaysia is represented in the following ways and methods: Sharia knowledge, belief in Allah, belief in the last day, patience and seeking reward, good deeds, companionship and good companionship, reading the Quran, contemplating on it and acting on it, remembering Allah, thanking Him, praying for the Messenger of Allah, supplication, seeking treatment with Sharia ruqyah and with psychological or alternative medicine, and striving to removing the causes that bring worries and obtaining the causes that bring joy. It is not permissible to treat these psychological diseases with forbidden means, just as it is not permissible to treat them with magicians and priests because of the great promise it entails and the existence of in disobedience to Allah. There are many studies and testimonies from psychiatrists and others that have confirmed the feasibility and credibility of these methods for preventing and treating psychological illnesses. This research will be a reference for researchers in psychiatry field as well as researchers in Sharia field and others. It will serve as a guide for them to expand the study of other psychological illnesses, explain their causes, and discover appropriate treatment methods for them. It is also a scientific guide for health institutions and relevant parties. These legitimate methods and techniques included in the model are effective medicine and efficient treatment for psychological illnesses under study and others. According to experts, implementing this model will help reduce psychological illnesses prevalent in Malaysian society, promote mental and preventive health, and raise the level of production in the country. Thank you.